Good morning. I'm Patrick Erickson with the Inland COVID Response Joint Information Center. We appreciate everyone being with us. This morning we'll have our daily update from Spokane County Health Officer Dr. Bob Lutz. And this morning we'll also be joined by Susan Joberg with the Spokane Regional Health District and Jason Campbell with CHAZ. They'll be discussing the alternate care campus at the Spokane County Fairgrounds and explaining the role CHAZ plays in staffing the isolation care center there. And of course, every morning we're taking questions from you. If you have any questions for any of our speakers this morning, please share them with us on Facebook. We'll try to answer as many as possible. And with that, we'll start with Dr. Lutz.
Well, good morning and happy Friday. We're just going to talk a little numbers today, and then I'm going to turn it over to Susan and Jason to talk about the alternate care campus. If we can see the first slide. So as we've talked about before, this is actually yesterday's data. I can tell you that we have 338 cases, which is an uptick, 16 new cases over the past 24 hours. 9 of those, however, were coming from the Veterans Home, where, as you know, we've been monitoring an outbreak. I am very happy to say that we've been having the assistance of the VA hospital and their great staff assist us in that effort. And so, but nonetheless, 9 individuals of the 16 are coming from the Veterans Home. And at this time, we currently have 11 individuals hospitalized. That's all I can tell you right now. Looking forward to your questions, and I'm going to turn it over to Susan. Thank you.
Good morning, everyone. I appreciate the opportunity to be here this morning to talk about the alternate care campus at the Fairgrounds. If we can show the map, I'll just give a quick overview. So this is a map of the whole Fairgrounds facility and the different activities that are planned or being planned for on that campus. There is a community screening, drive-through screening site that's been operational for some time now, as well as various locations for isolation facilities to be able to house individuals who can't safely isolate in the living environment that they are in. And that's a scalable opportunity with several buildings on the Fairgrounds campus. And then the third primary activity is what's called an alternate care facility. And in just a moment, I'll talk a bit more detail about what is an alternate care facility and why it's located in a large building on a Fairgrounds campus. So let's go ahead and, why don't I go ahead and talk about that right now. So the alternate, if you'll go to the next slide. So an alternate care facility is something that we would open at the end of many other phases of the healthcare system being able to surge with an influx of patients due to COVID-19. Medical surge planning is something that has been ongoing across the community with healthcare facilities for many years to be able to really push the capacity of every hospital in our area beyond what their normal operations look like, so that any patient that needs acute care would be able to receive acute care within a hospital. That's the ultimate goal during any emergent situation. So it's a phased approach where we're monitoring normal operations, which is the regular bed capacity, medical surge beds, pediatrics, all of that information. But simultaneously, we're beginning to build the plan in case we would ever have to open an alternate care facility at the Fairgrounds. There's a second phase where healthcare would surge into areas of their hospital that are appropriate for acute care, but they're not always staffed. So that would be the second phase that would be looked toward as hospital beds begin to fill. And that phase where the State Department of Health and Centers for Disease Control and the Assistant Secretary of Preparedness and Response have all worked closely with hospitals across our country to really identify the footprint of what's possible within the walls of any hospital, certainly in Washington State and in Spokane County. sorry, so if we can go to the next slide where I'm talking about normal operations. Those strategies to ensure normal operations can continue as long as possible have been to conserve PPE and to reduce elective procedures, and that's what we've been doing for the last month. We're monitoring bed availability, including ICU bed availability. As we would move to a new phase, the next slide, when we know that our normal capacity is getting close to its maximum, and moving into other beds that are available that aren't normally staffed would be the second phase. And again, we have metrics in place to be able to monitor as those percentages grow and those beds begin to fill up. And that's also when we would begin to prepare the building of an alternate care facility at the Fairgrounds. So we're staging the resources, identifying the staffing plan, beginning to train staff to that environment. The third phase, when the expanded beds within an existing hospital are full, part of the strategy would be to decompress hospitals so people who are recovering from emergent situations or even from COVID-19 would be transferred to an appropriate level of facility that may not always serve as an acute care hospital in our own community. For instance, Shriners or the Man's Grandstaff Veterans Medical Center is another location that doesn't actively serve as a hospital in our community, but absolutely can. And so those are two possibilities that we would expand into within a hospital environment while we're building an alternate care campus. If we ever got to the point where those additional locations were full, then the fourth phase is when we would be prepared to open an alternate care facility on the alternate care campus at the Fairgrounds. So that's that medical surge plan with an alternate care facility on the Fairgrounds campus as one of the services that will be provided in that location. The other area that I mentioned is that there's isolation facilities at the Fairgrounds where anybody from the community who is unable to self-isolate safely in whatever living environment they're in would have the opportunity to be cared for and monitored at the Fairgrounds in an isolation space. We have been able to use that space so far, and I'm going to have Jason Campbell from CHAZ talk about the huge role that they have played in making that facility operational.
Well, thank you, Susan. So by the time CHAZ was looped into this conversation, most of the groundwork had already been laid, and what we were able to contribute was clinical staffing at the facility, and then helping to coordinate some of the different resources to ensure smooth operations from start to finish. To give an overview of that process, it starts with triage. So the first aspect is mobile shelter triage. That has been led by Kylie Kingsbury and Kira Lewis with Spokane Regional Health District, and they've done a great job of creating teams who go out to the shelters every night from 5:30 to 8 p.m. To coincide with shelter check-in and screen upwards of 200 individuals and determine whether they need to be transported. The second component is the transportation, which is done by the Guardians Foundation. And so they are following the mobile triage teams and transporting individuals out to the facility. So upon arrival at the facility, we'll be met by either somebody from the Guardians Foundation or somebody from CHAZ, depending on the time of day. Do a quick check-in process, orientation process, and ensure those individuals have everything they need to be squared away for the night. The Guardians Foundation staff the facility overnight and have access to CHAZ's 24-hour on-call service in case they need to reach a CHAZ provider at any time of the night. So in the morning, CHAZ staff arrive at about 10 a.m. and we'll do a test, check in with those individuals, make sure they have everything they need. We have telehealth capabilities and some privacy areas out at the facility to link them with a primary care provider or with a behavioral health provider and provide prescriptions if needed. And we can deliver prescriptions from one of our CHAZ pharmacies. So we've been receiving about a 5-hour turnaround on test results. So as soon as we receive confirmation of a negative test result, we will start the discharge planning process and ensure those individuals have a way to get back to wherever they need to go. And that's sort of an overview of the process. And just for a little bit of levity, our team, since the Guardians Foundation has been playing such a big part of this role, we've been referring to it as the Galaxy. So I just want to give a shout out to the Guardians and thank them for all of their work.
We love that it's Guardians of the Galaxy out there. Thanks, Jason. I had mentioned that we've had the community drive-through screening site as part of the alternate care campus at the Fairgrounds, and that became operational on March 17th. Almost half of the tests that have happened in our county to date have happened through that screening location. It was a collaborative with all the healthcare system partners led by Providence, with Multicare, Kaiser Permanente, and CHAZ participating in making that community screening site available to individuals, particularly because we've had limited testing supplies. The criteria have remained fairly strict in terms of who qualifies for a test, but that screening site has served a huge purpose to both protect healthcare workers in various settings across the community, including urgent cares and emergency departments, as well as protecting consumers to not be in those environments where they may be exposed to each other inadvertently as they're trying to be assessed for a COVID test. So the last month, almost 5 weeks, have been an extraordinary success at that community drive-through site. It has given the healthcare system partners time to set up systems within their own healthcare operations, including their urgent cares, provider offices, and emergency departments, to assure that that testing and evaluation can come back into the healthcare system safely for patients as well as for healthcare workers. So we will begin a transition into improving access, honestly, to COVID-19 screening and testing. The Fairgrounds has been a great solution, but not convenient to everyone across our county. And we've wanted to really make sure that we can improve that access. And so that transition will be happening over the next week or so, in hopes that we will, that the healthcare system partners are ready to take that responsibility back on. So that's all I have about that.
We do have a question for Jason. One of our viewers is curious as to why it was important that CHAZ be involved.
Yeah, so when we were approached about potentially staffing this facility, we wanted to make sure it was up and operational as quickly as possible. So, and that was really because of two reasons. The first was to ensure that we were assisting our community partners in avoiding an outbreak scenario at one of the shelters. And also to ensure that individuals who, because of their living situation, didn't have the ability to safely isolate, had the ability to do so at this facility and still had access to the basic amenities that they needed.
And we have another question, this one for Dr. Lutz. A lot of people wondering about the numbers compared to the flu. So COVID numbers here in our community versus flu numbers, and how they compare not only infection but also mortality rate.
Yeah, sure. Unfortunately, I don't have those numbers readily at hand. I think the thing to note about comparing COVID-19 with influenza, seasonal influenza, is that the death rates are significantly greater at this point with COVID-19 than what we're seeing with typical flu. On average, we look at a less than 1% mortality or death rate with seasonal flu. This, depending upon where you are across the country, where you are across the world, we've seen mortality rates as high as 12% in Italy and less than 1% in countries like South Korea and Taiwan. A lot of it was just dependent upon how quickly the virus was contained, and I think that made a significant difference. So we will certainly see more people probably infected in a yearly basis by seasonal flu. Again, I don't have those numbers readily available, but for me the take home is that the percentage of people who die from COVID-19 is significantly greater than seasonal flu.
And we also have another question, this one talking about capacity here in our community. In case there is a surge, are we prepared for that? And if we were to have a surge, is that something that we could handle?
Yeah, so much of the work over the past few weeks has been to address just that. All of these efforts, these mitigating efforts that we've asked you to follow, the staying at home, the hand washing, the self-isolation if you're sick, those are all things that have been done in order to ensure that the healthcare system is strong and can undertake a surge if necessary. We've not seen that surge. There is always concern, however, that that surge may occur. And so at this time, we feel very comfortable in saying our local healthcare capacity is strong and readily available, but the caveat is that things change. And so that's the scary thing about this novel coronavirus. There's too much we don't know. And that speaks again to the reason why we are being very cautious in the reopening efforts, because if we open up the door too quickly, we might have to slam it shut. And if we open up too quickly, we may see that surge that really puts stress on the healthcare systems.
And another question, we've got this one, where are we at right now with testing versus where we were, say, a week ago versus a month ago?
Oh gosh. Last week versus a month ago. We're a lot better than we were a month ago. We're better than we were a week ago. We have a long ways to go before I really feel as if we've done sufficient testing to really get a sense of the amount of COVID-19 in our community. I am reassured from the Department of Health that we have more testing materials available. As has been talked about, our capacity is good. We need to ensure that not only the healthcare systems that have capacity to test, but also other sites are available for people who may not have a provider, may not have the ability to go in to an urgent care or the emergency room to be seen. And so that's why we have to look at this very systemically, that we ensure that any individual who has symptoms can get tested, and those tests can ensure that he or she knows his or her status and really helps us understand the burden of disease in our community.
This question also along those lines, if you were curious as to antibody testing and when we can expect to possibly be seeing that here in our community after hearing about that testing being done over on the west side.
Yeah, what's being done on the west side is still sort of experimental. Nothing is definite at this point. I don't know how many times we've mentioned about the antibodies, and what I will tell you about that is that there's probably more that we don't know than we know about it right now. There are 80 plus tests that have been fast-tracked by the FDA, what's called Emergency Authorization Use, EAU, of which only one, to the best of my knowledge, is being studied to both understand what amount of immune response is necessary to actually make someone immune, and then more long-term, how much immunity do you need down the road? How long will it last? Is it something that'll last a couple of weeks, a couple of months, a couple of years? So that's all why these laboratories are trying to understand the antibody response, and therefore the antibody tests right now, they sound great, but they're just not ready for prime time at this point.
And this will be our final question this morning. We had a viewer curious as to, are you comfortable with where we're at right now? What can we be doing to better protect ourselves and also our healthcare workers?
Yeah, I think that we have done well. I think that we are doing well. I encourage us to continue to do what we've been doing. Certainly, Governor Inslee's box in the virus strategy is dependent upon A, the continuation of these mitigating efforts, and then B, really being able to supplement testing so we truly understand who's infected, prevent those individuals who are infected from infecting others. So to date, I believe we have done well. We need to keep this work going. Otherwise, we might see that surge that was just asked previously. So keep on keeping on. And hopefully, as we understand more and more resources become available, we'll be able to slowly open the door and see maybe a light. Okay. Well, we thank you for tuning in today, Friday. I wish you a good Friday. And as I continue to work on my stay home, save lives, start again. Stay home, stay healthy, save lives, and wash your hands. Goodbye and have a good weekend. Thank you.